These are the questions that was asked in the last your MBBS examination. Ntr University Health Sciences, Vijayawada. Multiple choice question. 20 marks. Branched and filamentous bacteria are Bacillus anthracis, Actinomyces israeli, Corynebacterium diphtheriae, Clostridium perfringens. Which one is right? Actinomycetes. Actinomycetes israeli is the branched bacteria. One of the following bacteria do not produce oxidase enzyme. Vibrio cholerae, Pseudomonas aeruginosa, Escherichia coli, Neisseria meningitis. What is oxidase reagent? Tetramethyl, everybody. Tetramethyl, paraphenylene, diamino dihydrochloride. Make 1% of the reagent on a filter paper, rub the colony on it, purple color. See, oxidase positive organisms are VPN, you write VPN. Vibrio cholerae is oxidase positive, Pseudomonas is oxidase positive, Neisseria is oxidase positive. Escherichia coli, all enteric organisms are oxidase negative. Everybody, all enteric organisms are oxidase negative. All Enterobacteriaceae. Example of Enterobacteriaceae are, everybody. What happened? All Enterobacteriaceae are Escherichia coli, Klebsiella, Salmonella, Shigella, Proteus. All are motile except Klebsiella. All are motile except which one? Klebsiella. Process of random uptake of DNA fragment from the surrounding medium by the bacterial cell and incorporation of this DNA fragment into the chromosome is heritable form, and it is called as, what is this? Transformation, conjugation, transduction, transposition. What is it? Transposition, correct. Antibiotic that, antibiotic that acts by inhibition of protein synthesis in bacteria are ampicillin, gentamicin, ciprofloxacin, sulfadiazine. Which one? Which acts on the protein synthesis? Which one? Anybody in the class? Which one? Ampicillin is a beta-lactam antibiotic. It inhibits the cell wall synthesis. Gentamicin is the correct answer. It inhibits the protein synthesis. Gentamicin is aminoglycoside. Ciprofloxacin acts on DNA gyrase, inhibits the formation of nucleic acid. Sulfadiazine inhibits we take folate from outside, whereas bacteria synthesize folate from the human body. So inhibits the folate synthesis. So infectious and plastic biomedical waste infects. Please remember, look at this. Infectious plastic biomedical waste is disposed in red bin, yellow bin, blue bin, black bin. Hey, red is for what? On a starry night when you are sleeping, look at the moon and there is no clouds. Blue for there is a glass roof through which you can see. Glasses. What is the correct answer? Huh? Which one? Parrot. Red is glass. Which one? What is that? Infectious plastic biomedical waste is disposed in yellow bin. Red is glass. Correct. Red. Antibody that predominantly seen intestinal, respiratory tract and mucosal secretion. This is also called secretory antibody, IgA. It has got two molecules of immunoglobulin G held together by triangular secretory piece. It is found in the secretion, IgA. HLA-B27, human leukocyte antigen. HLA class 1, class 2 and class 3. HLA-B27 is strongly associated with myasthenia gravis, rheumatoid arthritis, ankylosing spondylitis, multiple sclerosis. Ankylosing spondylitis. Very good. Transfusion reaction is a manifestation of type 1, type 2, type 3, type 4 hypersensitivity reaction. What is it? When you give mismatched blood transfusion, it leads to acute renal shutdown. It occurs immediately. Ideal method for diagnosis of typhoid fever in first week is no Vidal second week. Blood culture. First week you remember blood culture. Second week Vidal, stool culture and urine culture. Okay. First week everybody. First week blood culture. Second week Vidal test. Third or fourth week urine culture. Stool can be, you can isolate in first week also, but blood culture is most ideal. Risk of transmission of HIV is highest, one among the following route. Blood transfusion, sexual intercourse, parent to child, injecting drug abuse. 100% blood transfusion. 99% blood transfusion. Large amount of blood is transfused. Needle stick injury, sexual transmission is all less than 3%, 0.3%. Gametocyte is banana shaped, larger than RBC, is seen in malaria caused by Plasmodium malariae, Plasmodium vivax, Plasmodium vivae and Plasmodium falciparum. Fox sickle, falciparum, good. Germ tube is useful in diagnosis of Candida albicans, Cryptococcus neoformans, Cocciditis immitis, Paracocciditis brasiliensis. So it is Candida albicans. We will tell you when we take up Candida albicans what is germ tube. You incubate into the plasma, there is a formation of pseudohyphae. It is also called Reynolds phenomenon. The Indian bacillary dysentery is commonly caused by, there are 4 species, Flexneri, Soni, Boydi and dysentery. Which one? Flexneri, very good. Urea breath test is useful in diagnosis of infection caused by Campylobacter jejuni, Helicobacter pylori, Clostridium perfringens, Clostridium difficile, Helicobacter pylori. Okay, we'll tell you in detail what is this. Viral gastroenteritis in children is commonly caused by rotavirus, Norwalk virus, adenovirus, hepatinavirus. Rotavirus. It wheel and a spoke. It looks like wheel and a spoke. Rotavirus. Hydatid cyst is a larval form of Taenia solium, Taenia saginata, Echinococcus granulosus, Haemolepis nana. Parasitology we have introduced, no, already. Classification and all. Parasitology we have taken one full class, no. It is Echinococcus granulosus. Echinococcus granulosus. Now repeat with me. Beef tapeworm is Taenia saginata. Pork tapeworm is Taenia solium. Dog tapeworm is Echinococcus granulosus. Fish tapeworm is Diphyllobothrium. Hold like this, double-headed. Diphyllobothrium, not Nagin dance. Diphyllobothrium latum. Latum. Diphyllobothrium latum. Rat tapeworm is Haemalopus nana. Dwarf tapeworm is Haemalopus diminuta. Okay, will you repeat with me? Beef tapeworm is Taenia saginata. Pork tapeworm is Taenia solium. Dog tapeworm is Echinococcus granulosus. Fish tapeworm is Diphyllobothrium latum. Dwarf tapeworm is Haemalopus diminuta. Rat tapeworm is Haemalopus nana, not Ajja Tata. Nana, Haemalopus nana. A combination of viral markers such as hepatitis B surface antigen, HBC IgM antibody positive, HBeAg positive in a patient who presented with complaint of fever, nausea, vomiting, jaundice is suggestive of acute hepatitis B with high infectivity, acute hepatitis B with low infectivity, chronic hepatitis B with high infectivity, chronic B hepatitis with low infectivity. Which one is correct? Hepatitis B marker. So you have antibody against HBC antibody and antigen is positive, E antigen is positive. Definitely is very highly infective, but you see antibody that is acute antibody HBC. So it is an acute hepatitis with high infectivity. Acute. So super antigen and simple antigen. If you both S and E antigen are positive, they are highly infective. A young male presented with painful crush injury on the left leg following road traffic accident few days back. On examination, wound was soiled, swollen, discolored, foul smelling, discharge present on the cryptus felt. Which of the most common cause of clinical condition? Clostridium novi, Clostridium septicum, Clostridium perfringens, Clostridium histolyticum. All causes gas gangrene. Which one of this? The answer is Clostridium perfringens. We'll tell you about perfringens. World Health Organization 3-drug regimen for the treatment of leprosy involves all except dapsone, ofloxacin, rifampicin and clofazimine. The correct answer is it does not include ofloxacin. Drug of choice for the treatment of nocardiosis: clotrimazole, ceftriaxone and ampicillin and doxycycline. Nocardiosis, again it's a branching bacteria. The drug of choice is ceftriaxone. One of the following is not a feature of Streptococcus pneumoniae. In simple form, it is pneumococci. Okay. Capsule absent, ferment sinulin, soluble in bile, optochin sensitive. Which one is correct? Google it and let me know the answer. Okay. Wool-Sorter's disease is caused by Staphylococcus aureus, Corynebacterium, diphtheria, Bacillus anthracis, Yersinia pestis. So it causes skin anthrax. On the skin it causes malignant pustule. If the wool contains anthrax spores, it causes Wool-Sorter's disease. If a man is carrying infected meat on his back, that is called Hyde-Porter's disease. And Wool-Sorter disease is pulmonary anthrax. Wool-Sorter disease is a pulmonary anthrax. Pseudomonas aeruginosa is intrinsically resistant to the following antibiotic except ceftriaxone, clotrimazole, chloramphenicol, piperacillin. Google it and find out. DNA garage genes in Mycobacterium tuberculosis confirm resistance to DNA garage. Please remember DNA garage. Which drug acts on DNA garage? Quinolones. Okay, isoniazid, 4-quinolones, rifampicin, parazinamide. 4-quinolones. Fluoroquinolones, sorry. Secondary bacterial pneumonia in patients infected with influenza virus is commonly caused by Staphylococcus aureus, Escherichia coli, Haemophilus influenzae, Streptococcus pneumoniae. Which one? Google it and find out. In pyogenic meningitis, CSF examination reveals except elevated pressure, elevated neutrophil count, pyogenic, elevated protein, elevated sugar level. Sugar levels are decreased. Elevated protein level, wrong. Correct answer. Except sporulated gram positive, very simple. Drumstick appearance. Which one? Clostridium perfringens, Clostridium tetani, Clostridium tertium, Clostridium biformentans. Which one? Drumstick appearance. Clostridium tetani. All the features of polio vaccine except duration of protection is lost long, expensive, local immunity in intestinal level is stimulated, propagates herd immunity. Which one is correct? Expensive. It is cheaper than parenteral Salk vaccine. All features of prior disease except long incubation period, strong genetic predisposition, invariably fatal, strong immune response is seen. Wrong. Except strong immune response is seen. Coma-shaped tachyzoids. Comma-shaped, again repeated. Tachyzoid here, not gametocytes. In the diagnosis of toxoplasmosis, cerebral malaria, African sleeping sickness, neurocysticercosis. It is Toxoplasma gondii, toxoplasmosis. Cercaria, larval form of Schistosoma hematobium, is transmitted to human by skin penetration, ingestion of contaminated food, vector bite, and sexual route. It is transmitted by skin penetration. Multiple bilateral vesicular tiny painful genital ulcers are seen in syphilis, lymphogranuloma venereum, herpes zoonoses. Bilateral vesicular tiny syphilis, it is chancre, it's painless. Lymphogranuloma, which is genital herpes, painful vesicles. One of the following tests does not detect specific antibodies for Treponema pallidum. Immobilization test, fluorescent treponema antibody test. VDRL is the non-specific test. Profuse, frothy, purulent, foul-smelling vaginal discharge along with strawberry appearance of vaginal mucosa suggestive of vaginitis. Candida, Trichomonas, Gardnerella vaginalis, and Google it and find out. One of the following is not true about post-streptococcal glomerulonephritis. Penicillin prophylaxis, prognosis poor, spontaneous resolution, repeated attack uncommon. Most common cause of mycotic corneal ulcer, Aspergillus, Penicillium, mucor, and rhizopus. Most common cause of acute suppurative otitis media, Staphylococcus, Streptococcus, Haemophilus influenzae, Moraxella catarrhalis. One of the following clinical manifestation is not included, classified as congenital toxoplasmosis. Microcephaly, microcephaly is not there. Hydrocephalus is there. Intracranial calcification, chorioretinitis. Kaposi sarcoma is caused by human papillomavirus, Kaposi sarcoma, Epstein-Barr virus, herpes B virus, hepatitis B virus. Kaposi sarcoma is caused by which virus? Carcinoma of stomach is associated with Helicobacter pylori, Bacteroides flagellis, Schistosoma hematobium, Aspergillus flavus. Which one? Helicobacter pylori. Thank you.